Hello, everyone. This is Khaira. I'm a urologist here at NorthBay Healthcare in Vacaville and Fairfield. And I got to appreciate Kelly for calling me young. That's the first time I've been called that in quite some time. I think it's because I've had to use the response to COVID hair and completely plaster it down. No haircuts available. So I'm going to be talking about prostate health, BPH, benign prostatic hyperplasia. I'm a urologist here at NorthBay. We cover all aspects of urologic health, and we're hoping that this will be a nice, helpful introduction to things that patients should consider getting evaluated if they're having problems. So I'll get right to the matter. So the first thing I just wanted to mention in this talk is NorthBay Healthcare has acquired a Da Vinci robot, Da Vinci Xi, which is the latest, greatest iteration of a surgical robot. Surgical robots have been around for more than 20 years. These are minimally invasive surgical tools that allow us to do very complex major surgery through small, fine incisions. And as a result, there's typically less pain after the surgery, quicker recovery, and oftentimes we're able to do things with less blood loss. We can oftentimes do surgeries that would entail big incisions on the abdomen through just a couple of keyhole incisions. So this is the Da Vinci Xi robot that we can see on the screen. This slide next to it shows these very fine instruments that we used in this surgery, or for surgeries. This is a $5 bill here, and this is a little model. And the next slide shows you what the surgeon would be seeing through that view, a very magnified view. This allows us to do very fine, detailed types of surgeries inside the abdomen and other parts of the body without the need for those large incisions. So it's something that we're very excited about. I've been doing robotic surgery for almost 18 years now. Very excited to have one in Solano County. This is the first robot in Solano County. But today we're going to be specifically talking about BPH. BPH, and then what it is and what are the treatment options. I think at the end of the talk, it'll be the best time that I can address questions, but if you have questions, you can send them on the little chat function there, and then at the end, I'll be able to go through those and address them. So what is the prostate? Can you see my cursor, Kelly? Mm-hmm. So the prostate is this orange organ right here. It sits right below the bladder. Only men have it. It's a male reproductive organ. It serves to create a fluid that's associated with reproduction, but after the point that a man does not want to have children anymore, it doesn't really serve any useful purpose. In fact, it causes mostly problems. So what are the problems that it can cause? Well, I'll get into it subsequently, but the urethra, which is the P tube, travels right through the prostate. So the prostate envelops the urethra. And like I said, it provides a fluid that's involved in reproduction. So what happens with the prostate? Well, men are born with it, and as they go through their teenage years into puberty, it gets to its adult size, which is usually about the size of a walnut. At about age 20, it's kind of peaked in terms of its size and in general stays at that size. But then we start seeing this phenomenon around the 40s or 50s. Many men start seeing increases in the size of their prostate. Now, the three conditions that we know of that very significantly can impact men from their prostate are prostatitis, which is inflammation, oftentimes related to infection of the prostate. There is prostate cancer, which is the most commonly diagnosed solid cancer of men in America. And then there is enlargement of the prostate, which we call BPH, benign prostatic hyperplasia or benign prostatic hypertrophy. But for ease, we call it BPH or big prostate. The Purpose of this talk, I'll be focusing mostly on enlarged prostate. So what was the scale of how the prostate enlarges? Well, I said at around age 40, 50, we start seeing some hyperplasia, hypertrophy of the prostatic cells. What that means is the prostate starts getting bigger in a lot of people. And as you can see in the slide, at age 50, about 40% of men have some signs of BPH. When they get to their 60s, that becomes about 70%. And then we find that by age 80, about 90% of men or so have some degree of BPH. So overall, this affects about 38 million men each year in the United States. And what exactly is this? Well, it's enlargement of those benign cells in the prostate, those cells that were having a purpose when a man was in his 20s or 30s. Now they're just getting bigger and multiplying, and it's a non-cancerous enlargement. This is a benign growth. So unlike cancer, where things can grow and spread to other parts of the body and be life-threatening, that's not what BPH is. It's just enlargement of those cells and that tissue that's causing the prostate to cause more urinary problems. We do see that the PSA, the prostate specific antigen, which is a blood test, can go up in the setting of BPH. So it's something that needs to get further evaluated if a man's having a rise in his PSA, because the other condition that can cause this is prostate cancer, obviously. So in these circumstances, again, very important to get checked out by your doctor. The next two slides will kind of show what is the impact of the prostate enlarging. Well, first off, as it enlarges, you can imagine that the channel, if you can see this tube right here, the urethra tube, starts getting impacted by the prostate. And I liken it to a fist squeezing around a straw, or even better, a foot stepping on a hose. And as a result of that, you can get a whole variety of obstructive symptoms, urinary symptoms, but more importantly, you can start getting these changes that that you can see in this picture here. So this is a normal bladder, a nice thin-walled bladder with an open urethra going through the prostate that doesn't appear enlarged. In this cartoon over here, we see that the prostate has enlarged and it's constricting the urinary stream. Now, as a result of constricting the urinary stream, you can see the bladder has gotten much more hypertrophied, meaning it's gotten more muscle, thicker muscle. And as a result of that, we see these changes in the bladder. And I'll talk about that subsequently. What is the impact of these changes on a patient's symptoms? Well, this is showing what happens if that BPH is not treated and it's allowed to go down the natural course of worse and worse obstruction. First off, what you would see is the urethra gets obstructed here. The prostate acquires more muscle. And we also see collagen, fibrous depositions within the bladder also. And why is this a problem? Well, unlike other parts of our body where you really kind of, it's a great thing to have muscle, have bicep muscles or triceps or pectoralis, and people want to build up that muscle. Bladder is not an organ that works well if there's too much muscle. And the reason why is it's supposed to be a functional, compliant organ, and compliant is stretchy. And obviously, muscle is not nearly as stretchy. I liken it to my patients saying, imagine like a bodybuilder who's got so much muscle that he can't do the full range of motion of his arms, and it's kind of can only do this. Same idea. The bladder can't fully expand and can oftentimes not contract very well either. Certainly, you can maintain emptying and you can still get your bladder emptied out in that circumstance. but you can't hold your urine very long. There can be more urgency to get to the bathroom because the bladder pressure has gone up because it's so muscular. And in the worst case scenarios, it can lead to the bladder starting to squeeze on its own. We call those uninhibited contractions. And sometimes that can lead to people losing control of their urine where they're wetting themselves. These are more of the irreversible type of problems that develop if the prostate obstruction is allowed to persist unabated. So these are some of the reasons that we want to treat prostate obstruction earlier as opposed to waiting when things get really bad. This is another representation of the natural process of benign prostatic hyperplasia over time. If you imagine this is the bladder up above, the P tube coming right down through here, the urethra, and this is the prostate. This is the normal open channel, and this image down below represents what we would see if we put a little scope in the urethra. And the black back here is the bladder, and on the left and the right are the prostate. So the prostate channel is open. It's a good clear channel to empty the bladder. Now, as the prostate starts enlarging, if you imagine this is a man in his 40s or 50s, and he's starting to get this benign growth, you can see it's starting to squeeze on the urethra stream there. And as a result, now when we look in with the scope, what do you see? You see the prostate starting to close off, and you start seeing the opening for the bladder is up there, not nearly as wide and open as it was previously. And if that disease process is just allowed to continue without any intervention, oftentimes that benign growth can take over the whole prostate and completely obstruct that channel. So this image represents what we would see in a very obstructed prostate with the scope looking into the urethra. You see this tiny crack is what the man is having to empty his bladder through. So he's having to generate a lot of pressure from the bladder in order to get the urine to pass through the obstructed urethra, which is obstructed at the level of the prostate. And again, this patient may be feeling like he can empty out his bladder, but the concern, like I said on the previous slide, was that bladder may be getting thicker, more muscular, more hypertrophied, and as a result deteriorating, because there's a certain point where the bladder won't be able to compensate any further without having more and more serious effects for the patient. So what are the symptoms of benign prostatic hyperplasia? Big prostate. Well, there can be a myriad of symptoms, and we usually categorize these into both irritative and obstructive symptoms. So irritation, in my mind, liken to when the bladder is just irritated. It's struggling and is having a hard time. So a good example is frequent urination. A bladder that is really having a hard time emptying and needs to have a lot of muscle associated with it will not be able to stretch as much. And remember, in our general hydration, we're constantly just making urine. Our kidneys are making urine, sending it down to the bladder. Normally, that bladder should be pretty quiet. It should wait a couple of 3-5 hours before you get the urge to go. You should be able to go to the bathroom and empty out. But if that bladder just doesn't have the compliance, the stretchiness because of that BPH, you oftentimes find that people have to go to the bathroom really frequently. And that can be day and night, so getting up at night to go to the bathroom, which can be a real hassle because of the sleep disturbance and the other impacts of getting up 3-5 times at night. The sudden urge to urinate. Remember, I talked about the uninhibited contractions, and that's when the bladder just decides, I can't hold anymore, and it squeezes on its own. And oftentimes the patient is really fighting to keep the urine in, but can have leakage as a result. Then on the other side of it, we also have patients that have obstructive symptoms, like it's really hard to get the urine going. The outlet is so obstructed that the stream is really slow, not emptying very well. You know, in that circumstance, oftentimes that means the bladder hasn't compensated, and now the obstruction is just really severe. And then on top of that, when there's a really bad obstruction, you can sometimes see that the bladder doesn't empty very well, and there's leftover urine in the bladder. And this is worrisome because it can be related to bladder stones, urine infections, and kidney damage. And lastly, there can be what we call hesitancy. So someone goes to pee and the stream starts, but then stops, starts, then stops. And that is another obstructive symptom related to BPH. I mentioned before that there's lots of things about BPH that can impact people's lives. I find that the sleep disturbance can be really bothersome for some patients. Some patients getting up those 2-3 times, they have a hard time getting back to bed, and as a result, they're fatigued during the day, and it creates just a never-ending cycle of tiredness during the day and just a loss of pleasure in the activities of life. I have patients who live here in Solano County who just say, I can't get to places I want to go without mapping out a trip to the bathroom. Classic example is going to to San Francisco. If they wanted to go see a show, they say, I'm going to have to plan somewhere along the way on that 1.5 hour drive that I have to stop to go to the bathroom. Or if they want to go see a movie, they're very worried that they're going to have to sit near the aisleway and have to get up in the middle of the movie to go to the bathroom, that they're not able to hold their urine 2 to 3 hours for the movie. And then when things get really kind of troublesome, people start avoiding the things in life that they enjoy doing because maybe the leakage worries or just the embarrassment associated with the bladder problems and not being able to fully empty or being just a burden to people around you because one has to go to the bathroom so much. So this is not an uncommon problem, like I said previously, but we do have lots of treatment options. And one of my main reasons for wanting to give this talk is to encourage people, if you're having these problems and these symptoms, it's a good reason to get investigated with your doctor. So, as I was saying, one of the main reasons I give this talk is to let people know that there's options. And what I oftentimes find with really intelligent people that have avoided coming to see their doctor about prostate problems is that they were worried. There was a terrible fear that something horrible would be involved in the examination and the treatment. And so this next slide kind of tells you what we normally do in the medical setting. First and most importantly is we ask questions and find out how long the problem's been going on. What are the degree of symptoms? What exactly is happening? And then we do an examination, and sometimes this can incorporate in the office doing a little ultrasound of the bladder, an examination of the prostate where one finger is put up the rectum to evaluate the prostate, both its size, its texture, and its symmetry. Now, this is an important test that all men over the age of 50 should be getting on an annual basis because it also serves to screen for prostate cancer. And if you remember me saying, this is the most commonly diagnosed cancer of men in America, and it's the second leading cause of cancer death for men in America. So there's multiple reasons to get the annual prostate exam in addition to just looking at the urinary symptoms. And classically, we're going to ask some questionnaires, and there's a questionnaire that I give my patients a lot. And when we give this talk in a public format, we kind of pass out this questionnaire so people can see their score, but we don't have that opportunity here. Some other tests that we oftentimes do are ultrasounds of the prostate, having you pee into a machine to see how the force is, and then classically we're going to want to at some point look inside with a scope, particularly if we think additional treatment is necessary. And again, these are outpatient procedures, usually done in the office setting, very, very safe, effective measures that you don't need pain medicine for. We use local anesthetics for these procedures. And this is talking about that questionnaire that I mentioned, but there's a reason that we give this out because it gives us a great understanding of how severe the symptoms are on a scale compared to yourself in the past and then in the future too. So I'm going to now kind of transition into a discussion of what are our options for the treatment of enlarged prostate. I'll be talking from the scale of the watchful waiting, the use of medications and herbal remedies, the UroLift procedure, heat-based therapies, and the transurethral resection of the prostate and laser ablation of the prostate. So, the first option for people that are having mild urinary symptoms that we've attributed to the prostate is we oftentimes say, why don't we kind of do some lifestyle changes and see how things are doing? We can call this watchful waiting or lifestyle changes. And what does that entail? So I may see a patient who's saying, my main bother is I get up once or twice at night, which I never used to before, and I don't like that. And so one thing we can do is say, well, what time do you go to sleep? Okay, you go to sleep around 10 or 11 at night. Why don't we cut back on all fluids after 8 p.m. at night? Create a little bit of a dehydration overnight. And as a result, sometimes that nocturia, that getting up at night to go to the bathroom, can be reduced to 1 or no times. And this is great. It's the one problem that was affecting the patient. Other things that can be bothering patients. Sometimes people tell me, I'm pretty good the whole day and even at the night, but in the morning when I'm up between maybe 6 and noon, I find myself going to the bathroom every 30 minutes or really frequently, a lot of urgency. Ask a few questions, find out, oh, you drink 3 cups of coffee at that time. Well, coffee is a big irritant for the bladder, and as a result, that may be a big component of those urinary symptoms. Albeit the prostate may be contributing to the symptoms, but the coffee is making it worse. So we sometimes will try reducing the coffee intake or switching to decaf and see if that makes a difference. So what are the advantages of doing these sorts of things? Well, certainly we're not getting any side effects of using drugs, and we're not doing surgical interventions. But the disadvantages, if the symptoms are more severe or progressive, because remember I talked that the prostate can continue to grow over time, sometimes these lifestyle changes are not enough, and people will need something else done in the future. So what are the less invasive or medical herbal remedies out there that we have for the treatment of BPH? We have 3 different classes of medications. Some of the brand names include Flomax, Avodart, Cialis. And what these medications do is through different mechanisms impact the prostate to improve flow, improve emptying, and in turn reduce those urinary symptoms that we talked about previously. Better flow, less urgency, less incomplete emptying, all can result from taking one or a combination of these medications. People like this because it's not a surgical intervention, and it may be enough. Sometimes we start patients on one of these medications, and that's by far enough, and they don't need anything else done. Now, the disadvantage, obviously, is you have to stay on the medication for it to work. So if you stop the medicine, the symptoms would come back. And sometimes, as I said, the prostate will continue to grow, so the medication will not be enough over time. Sometimes we have to go to a higher dose of the medication or add other medicines in conjunction. And then what do people find most bothersome as well? There's the cost of the medications, and if there are side effects, these can be bothersome. Things like retrograde ejaculation, so when there's climax, no ejaculate comes out of the urethra. Instead, it goes up into the bladder and you pee it out later. Sometimes sexual drive can be diminished. Times there can be an impact on breast enlargement or some fatigue. These are the rare but definite complaints that some people have of taking these medications. And on top of that, some people just don't like being on medications on a regular basis. There are herbal supplements that some people swear by. These are not FDA evaluated, and there aren't very good studies that establish that these herbal supplements necessarily are better than placebo, but we certainly have a large population of patients that swear that this is having an impact. And I think the classic one is saw palmetto. It's a herbal supplement that's been around for years for prostate symptoms. Generally, there are very many side effects from these medications. People avoid having to take drugs and surgery, but the disadvantage of taking these supplements is sometimes you just don't know if it's working. You don't know because it's not FDA evaluated whether you're getting one purified version versus another. There's a lot of inconsistency in terms of using herbal supplements. Prostate heating is an in-office type of procedure. There's numerous ways that this can be done with microwave energy, heat energy, steam energy, to reduce the volume, the size of the prostate. This has been moderately effective and at times very effective for BPH symptoms. What people like about these types of procedures is we can do it oftentimes in the office setting, so you can avoid needing a general or spinal anesthetic. It's covered by insurance. And then the side effects are, sometimes it takes a while for those symptoms to go away. In general, by heating any part of our body, we get swelling and edema, so there can be a temporary worsening of symptoms. And usually with the heating procedures, we have to leave a catheter in place that can stay up to about a week or so until the catheter can come out. And a catheter is a little tube that goes into the bladder to drain the urine. When the swelling goes down, then the catheter can come out. Then over the course of about 1 to 2 months, people can oftentimes see that great improvement in their urinary symptoms. Now, the gold standard of therapy, what's been around for over 100 years, has been the transurethral resection of the prostate, the TURP. And this has got so many colloquial names. My patients sometimes call it the roto-rooter, that they know somebody who had it done. And this procedure is one which involves putting a scope into the urethra under anesthesia and then surgically removing the obstructing tissue. So you can see over here the process of a transurethral section of the prostate. And the end result is the channel is wide open, so there's good flow and good emptying. This procedure, like I said, is one of the gold standards for the treatment of BPH. It has been tried and true to have very good, durable, long-term improvements for urinary symptoms. But it is a surgical procedure, and with surgical procedures are the associated risks and concerns. One is that oftentimes needs a hospitalization, and if it is, it's usually overnight or 2 days at the most. There is typically a need for a catheter in the urethra that can stay a few days. And then the first month or so after the procedure, there's going to be a need for recovery time. There can be on and off bleeding, and there can be some side effects related to the procedure as well. A variation of prostate outlet surgery is the laser ablation of the prostate, which is a procedure that we utilize as well here at NorthBay Healthcare. And that is a similar basic principle to the transurethral resection, but instead of surgically cutting out the tissue, we use a laser that evaporates that tissue. And as a result of evaporating the tissue, there's less bleeding, oftentimes a quicker recovery, a shorter period that one necessarily needs a catheter in their bladder. And usually the procedure can be done as an outpatient, so you're able to go home after the procedure and get the catheter out the next day. This takes us into the UroLift, which is a office-based procedure, also can be done in the hospital or surgery center setting. This is a newer procedure. It's been around in some form for the last 15 years. It was FDA approved about 7 years ago. The procedure involves placing little clips inside the prostate that would mimic placement of, let's say, a stent. And as a result, the channel of the prostate is opened without actual cutting, evaporating, burning, or heating of the tissue. What we've found with this procedure is people get very good relief of their symptoms while still having a procedure in a minimally invasive approach, as I said, in the office setting. Most patients do not need a catheter after this procedure, and oftentimes the irritation symptoms are relieved within 1 to 2 weeks after the procedure. Now, the disadvantages, there is some blood in the urine that can last a week or two. There is some burning when one goes to the bathroom for the first week or two, and along with that, some urgency and frequency. But in general, these symptoms abate within the first week or 2 weeks. So how does the UroLift system work? This representation here is showing a bladder and the prostate left lobe and right lobe over here. The scope is introduced inside the urethra, and then compression of the prostate tissue is made with the scope, and the device is delivered through the prostate. And how does that work? Well, the prostate has a very tough, leathery skin on its outside, so the UroLift clip will anchor on that. Then a surgical suture is between the two clips, and another clip is deployed on the urethra side. As you can see, what's happening here is the prostate is getting compressed. It's getting squeezed. And in the process of placing the clips, you see that the urethra channel subsequently opens. So this is the obstructed channel at the beginning of the procedure. And after the UroLift clips are placed, now the prostate channel is open. What is it made out of? Well, the clip is made out of a surgical metal called nitinol. Then there's a polyester surgical suture in between. This is what traverses the prostate parenchyma. And then there is a stainless steel clip, which is also a surgical clip that's on the urethra side. These are fairly small. They do not set off metal detectors. You don't need to have any special screening if you have a UroLift procedure when you go to the airport. And for Tesla magnets up to 3 Teslas, we have found that it is safe, which are basically all kind of magnets, MRI magnets that are out there conventionally in our area. So, will this work?
Yes. Okay. No, actually, it won't. The sound won't.
I'm going to skip that slide because the sound won't travel through, but I'll show you. This is an actual representation of an obstructed channel of the prostate. So this is the right lobe of the prostate, and this is the left lobe, and this is the posterior. So what we're seeing is, as a scope is put right into the urethra, you cannot see the bladder in the background. This is completely obstructed. So the UroLift system is deployed. Those UroLift clips are delivered into the lateral lobes, and subsequently, this is probably 5 or 10 minutes later, this is the end result. You see the bladder in the background. The channel is now open. The prostatic urethra is no longer obstructed. What would one expect after they have a UroLift procedure? As I said, the first week or two, there may be more urgency to go to the bathroom, so a little bit more frequency. There can be some burning when one goes to the bathroom, usually resolves within the first week or two. And the stream will, because the bladder's not filling as much because you're going to the bathroom frequently, the stream may not be hugely impacted. Generally, by about 1 to 2 weeks, as those symptoms start to abate, patients start noticing the improved force of stream, the improved sense of emptying, the less getting up at night. And what typically happens is between 2 and 6 weeks after the procedure is when the great improvements come in. So there can be on and off a little bit of blood for the first month or so, but like I said, that's quite minor. And most people are able to get back to regular activities within a week or so. This slide is a bit dated because symptom relief has been proven to be at 5 years or longer. The study went out to 5 years, and at that point, the study was closed. But we are seeing consistently patients with this treatment having great results, greater than 85% of patients at 5 years not needing anything else done for treatment of their enlarged prostate. So a nice long-term durable improvement that we're noticing, which is very closely equivalent to the surgical outcomes, while avoiding all the risks, side effects, and discomforts associated with surgical intervention. This is a procedure that's been covered by Medicare for 5-6 years. Almost all commercial payers are also covering it in our area. It is not something that we're considering new or novel. It's a well-recognized, established treatment for the benign prostatic hyperplasia. So where to go from this point on? Well, number one, if you are having any kind of urinary symptoms or bother, I would highly recommend at the very least touching base with your primary doctor. If you're a man over the age of 50, you should at least get an annual checkup with your primary doctor for prostate, like I said, for the screening of prostate cancer. And in that same setting, if there are urinary problems going on, you can communicate with him. We here at NorthBay Urology are also available if you have questions, want to come and see us. And I will stop there. All right, so I'll start looking at the questions over here. Do we have any questions?
Just the one about the VA.
There's a question. Heard that the VA urology department was doing a new prostate surgery. Sorry, no name. Are you doing any new prostate procedures? Well, new is oftentimes having to do with whether they've done it before. So we've been doing the UroLift procedure since 2014. I wouldn't consider it in any shape or form new for me or in the world, but there's some institutions that may not be doing that. There are other prostate procedures out there. We are pretty much doing any and all prostate procedures that are approved by the FDA, that are commercially available. We're well skilled and trained in all treatments for benign prostatic hyperplasia.
Any other questions? Great. If there are any other questions, put them in the chat. Put them in your ask a question. We don't see any other questions there. Give it a few minutes. We do want to say thank you very much, Dr. Khaira, for this talk. And this talk will be recorded and you can do it anytime on our website at northbay.org. So without seeing any further questions, we will close this broadcast. And thank you very much, Dr. Khaira.
Thank you. Take care.